Doctors of Reddit. What patient made you go, how the duck are you even alive? Belligerent guy comes in a wheelchair. He doesn't want to be here. He's ducking fine. The party was good. Ems ducked his evening up. Ems brought him in from a bush party. The guy had a chainsaw stuck in his thigh and shin. Literally jammed in his leg. And severe burns after falling into the bonfire on half his body. Guy was hammered. Didn't seem bothered by the fact he was severely burned or had a chainsaw in his leg. He ended up losing the leg below his knee and got a nasty infection from the burn. But still, if his leg wasn't completely ducked, I'm convinced he'd have gotten up and tried to fight people. I have a hospice patient that has been on our service for 4 years. I'm either really great at hospice or really bad at it. My father's doctor couldn't believe A, he didn't need to amputate his feet, and B, he was still alive. Dad had brittle diabetes. His pancreas would kick in and out due to a congenital deformity. At 82, he had significant heart issues, including angina, enlarged heart and clogged arteries. One day, his feet went black. Not just bluish or gray, black as charcoal. Rushed to emergency. We were told they would amputate, but to say our goodbyes. Dad refused surgery. Said he'd rather be dead. At his age. Hours later, his feet were pink. We took him home that morning. Doctor actually apologized for upsetting us, but said he'd never seen anything like it. Veterinarian. Dog hit by a train. It severed the dog's leg and the dog carried its own leg home. Owner brought dog and leg to the Edit. Leg could not be reattached due to significant damage to limb. Dogs do great as tripods though. During residency, my IQ patient had to have his chest reopened less than an hour after 6-hour open heart CABG surgery. He needed 12 units of blood. His heart massage then shocked 4 times. Cardiothoracic surgeon and the IQ operating, because no time to go back down to walk, was an illicit drug abuser and alcoholic. Nurses called him the cockroach. I checked in on him for 4 weeks. He was unresponsive every day. On week 20 we had to consult Ent to take maggots out of his nose. I was sure he was a goner after that. Week 3 passed. No change. Week 4. Day 24 I believe. At 6 AM. He opens his eyes. I was shocked. He has a permanent tracheostomy now, but somehow is alive. I had a patient who was literally cut in half at the pelvis after a car hit him and pinned him to a telephone pole. Paramedics carried his legs in separately. He was wide awake and talking to me as we quickly put in a central line, and he got all the bleeders ligated by like 5 different surgeons. He declined pain meds repeatedly. What a legend. He was in the OR 5 minutes later. Luckily this was at a major academic center with an exceptional trauma surgery team. Apparently the guy lived. Not sure what his quality of life was after, but pretty crazy. I work in trauma and once had a guy fall off a roof. He said he remembered hitting the bars on the scaffolding on the way down. We originally thought he'd fractured his femur, but nope, just a small hematoma. He was in bed next to a man who had broken his ribs and had a small C-spine fracture when he fell forward picking up his keys. EMT here. Brought in a PT whose now former girlfriend stabbed him in the face with a chef's knife. The knife went through his right eye, missed his cranial cavity, and stopped about a millimeters from his brainstem. The X-ray was nuts. We showed everyone. As a med student on my emergency rotation, I had a guy brought in who had fallen off a 7th or 8th floor balcony and landed on his head, essentially door, and we couldn't get a blood pressure when he got to the hospital. As a student my job was to basically stand to the side and squeeze the bajillion bags of blood that went into this dude. His cervical spine was essentially dust on the initial CORD scan we got. I figured he probably wouldn't have made it, but about a month later I'm now on my IQ rotation and I see this guy awake and conscious. Pretty crazy. Obligatory not a doctor, but my daddy's, and he liked to tell us about the crazy crap he saw. This post made me think of one of those in particular. Huge guy. Linebacker build. Came into the trauma ward with a gunshot, wound dead center of the chest. He could breathe fine, and he had a pulse. So they did a chest X-ray and found that the bullet had spent all its energy getting through this guy's sternum and was just resting on his pericardium. My mom's a doctor. I asked her about this when it came up on Reddit. When my mom was in her cycle during internship, man with police officers behind him came in the The man was perfectly fine and walking. So my mom and her colleagues were confused. The officers showed them a picture of a crumpled metal piece, which was a car. It didn't look like a car at all. Just metal trash. The officers told my mom and her colleagues that they rescued the patient from the car, which was lit on fire only a few seconds after they rescued him. The patient didn't have a single scar on him, was perfectly fine, and got his name around the hospital for being immortal. Airlifted pregnant female with GSW to the head. Arrived intubated and non-responsive with the bullet lodged in her right occipital lobe. Self-extubated the next day and left the hospital against medical advice 2 days after that with only minor visual deficits. Unbelievable. My sister was the patient. But every doctor who's gone through her whole file has had this reaction. When was 9 she fell around 35 feet off a bluff and landed headfirst on bedrock. Shattered every bone in her skull. A very well-known neurosurgeon took a look at her when she was brought in. Said sorry, there is absolutely nothing I can do for her. I'd say she had a 10% chance of surviving the night. Say your goodbyes now. 3 weeks in a coma. 3 months in an ICU. 6 months as an inpatient. She's still alive today. She has permanent damage of course. But holy cow, can kids' bodies recover from a lot? My dad is 87. He had prostate, liver, bowel, colon and skin cancer. For the skin cancer he had lots of reconstructive surgeries. His whole tibia region and the back of his hands. Every year he has to have at least one skin lesion removed. He had a couple of heart attacks and then a sextuple bypass surgery. He also had a big pneumonia, a huge abscess and a small stroke. His doctor wants to see him every 6 months. I think just to be amazed that he's still walking around. I'm a psychologist. Not an MD or do. But I work at a psychiatric hospital. Anyway, one of my patients a few weeks ago was a 15-year-old boy who was regularly neglected as an infant by his mother, who was an addict. When he was around 5 years old, his mom pimped him out to men for sex in return for drugs. When he was 9, his stepfather gave him a skull fracture after beating him with a wrench. When he was 14, the same man shot him with a pistol for talking back. He's in foster care at the moment and suffers from PTSD and depression. But he's the sweetest boy I ever met. I wish him the absolute best in life going forward. He deserves it. Doctor. Oh my goodness. So many patients. Too many to tell. One good one. I once took care of a guy in the rural south who came to the hospital because people said he was growing salt. And he was totally covered in what looked like snow. Uremic frost. I said. Since I was fresh out of residency. Guy had been in renal, kidney failure for 3 months and had been vomiting every day, which kept his potassium low enough that he didn't die. But it was still 9.7 and his ECG was a sine wave and he definitely should have been dead. Google uremic frost. It's a good one. Type 1 diabetic in their 20s presented dead of DKA. Unresponsive. No pulse. In VF. Multiple rounds of CPR. Defibrillated. Eventually stabilized in ICU. Self-discharged immediately after being extubated less than 48 hours later. My mother. We used to live in East Texas and my mom had this lady come in and had a huge infected wound in her leg, like massive to the point they might have to amputate, and she had asked her why she waited so long before coming in when it was obviously festering. Well, turns out this woman was letting her dogs lick it clean because their mouths are clean, and she was soaking it in Dr. Pepper because doctor had her thinking it would help. Needless to say, my mother looked at her like a deer in the headlights when she said that. Edit. Talked to my mother, she also said there was a couple canine teeth in it because the lady had an old dog. My friend in nursing school was in charge of checking in and out a habitual patient that also was seen by a full nurse and doctor. On checkout she noticed a bandage on the guy. Oh, that's for my hole. The guy had an open sore that kept getting bigger and bigger, and he had stuffed 3 t-shirt in it. He had been having repeated health problems and they just listened to his lungs. Would give him an antibiotic and treating him. I had liver failure. When I was 8 months pregnant, my baby had stopped moving for several hours. So they did a C-section. They found out during blood work that my liver had failed. I almost needed a transplant. I bled so much that my body used up all its clotting stuff. I was in ICU for 3 days. In hospital for 2 weeks. My liver recovered. I went home with my son. We could both have died. The hepatology department and maternity department were working together, which is not a usual thing for them. Edit. It was acute fatty liver of pregnancy. I had a patient in the emergency room who had been involved in an awful car accident where firefighters and paramedics spent an hour trying to get him out of his car. Reportedly, he attempted to walk to the ambulance, and when he arrived he was awake and talking. Confused speech. But still. Then paramedics signaled the back of his head to me. His skull was popped open on the back so much that I could see inside. We paged the brain surgeon immediately, and the patient was taken directly to the operation theater. Months later I heard from my colleague that he was still alive and had no damages other than some occasional balance problems. Not a doctor, but was the patient. When I was in boot camp I developed an upper respiratory infection during second phase. I didn't want to get dropped back at platoon, so I gutted through. Got back and went to sick call where they treated me for a host of things. When they x-rayed my chest, the doctors came out with my films and literally asked, how the hell are you still alive? Your lungs are so full of mucus you should be dead. Turned into walking pneumonia at some point. I also had athlete's foot that turned into cellulitis and my last wisdom tooth yanked. So the combination of meds they had me on was enough that I don't even remember that week at all. I'm not a doctor, but I did meet a patient who fell from a 5-story building, landed on his upper back, woke up in the hospital the next morning, and got up walking around like nothing ever happened. Barely a scratch on him. Think about it every time I'm in a building with at least 5 stories. Just looking down like how in the world did this guy walk away from that, like he fell off his bike and took a nap. Actually, I've seen worse injuries from someone falling off a bike lol. 35Y/O male. Casual plasma glucose was 600. The guy came for a slight headache. Paging Keith Richards doctor. You're wanted on Reddit. Stat. I almost died 3 times while being a kid. First for illness. Second because I had a bright idea to eat a poisonous office plant, and third because I managed to fall from the stairs cutting somehow my left wrist. All when I was 2 to 3 yo. As a bonus I could add a 4th time. When I heard my sister saving me by catching me from the heels while I was going to fall off a window after my attempt to call the dog outside. I still ask myself how TF I managed to stay alive for 27 years. Edit. Whoa, 500 likes. Nice.